World Mental Health Day, observed on 10th October every year, is an international day for global mental health education, awareness, and advocacy against social stigma. It was first celebrated in 1992 at the initiative of the World Federation for Mental Health, a global mental health organization with members and contacts in more than 150 countries. This day, each October, thousands of supporters come to celebrate this annual awareness program to bring attention to mental illness and its major effects on people's lives worldwide. In some countries, this day is part of an awareness week. World Mental Health Day was celebrated for the first time on October 10, 1992 at the initiative of Deputy Secretary General Richard Hunter. Up until 1994, the day had no specific theme other than general promoting mental health advocacy and educating the public. In 1994, World Mental Health Day was celebrated with a theme for the first time at the suggestion of then Secretary General Eugene Brody. The theme was improving the quality of mental health services throughout the world. World Mental Health Day is supported by WHO through raising awareness on mental health issues using its strong relationships with the ministries of health and civil society organizations across the globe. WHO also supports with developing technical and communication material. This year's theme set by the World Federation for Mental Health is Mental Health for All.
The theme for World Mental Health Day 2020: Greater Investment, Greater Access. This theme bears tremendous relevance in the COVID-19 scenario. It would be a cliché to repeat that this is a time of uncertainty and fear. Nevertheless, added to the fear of getting infected with coronavirus are the life-altering changes every person in this world is going through in this global pandemic. We have had to change the way we live, the way we work and study, the way we interact with the people in our life. Working from home for months together, getting the children used to distance learning, facing the prospect of unemployment, the loss of people facing contact with our friends and colleagues has put a strain on the psyche as well. Investment in mental health care and access to it was already rather sparse in India. People who are already suffering from anxiety, depression, suicidal tendency and bipolar disorder aren't able to consult their analyst in person. Psychiatrists and psychotherapists has witnessed a steep rise in suicidal thought among youth people during this lockdown, according to a recent survey in India. So, greater investment and greater access in this field is a non-barrier. While COVID-19 has increased the spotlight on mental health, the stock-taking of how greater access to mental health care can be improved must always be a continuous process. We can always do more to strengthen mental health response and support in our community. These investments are not purely the government's responsibility, nor should doctors be the only answer for those suffering. These investments are the responsibility of all. More importantly, they indicate that we ourselves are an untapped resource in mental health care.
10 tips for maintaining mental well-being. Tip number 1. Sleeping well. Lack of sleep can cause stress, moodiness, physical exhaustion, and other health issues. Try going to bed when you are tired, drinking a glass of warm milk, and turning off the TV at least 30 minutes before you go to bed. Tip number 2. Enjoying healthy food. Good nutrition can be just as important for your mental health as if it is for your physical health. Try to eat regular well-balanced meals and maintain adequate fluid intake to ensure you feel good. Tip number 3. Planning and prioritizing. Focusing on one thing at a time, keeping calm and planning ahead can improve your skill to cope up with your life's pressure. Tip number 4. Tuning in. Listening book, or study can help you relax and even increase your creativity, productivity, and focus. Tip number 5. Cutting down. The amount of alcohol, cigarettes, and other drugs you consume can have a negative impact on your mental well-being. Try cutting back on your intake and set yourself realistic goals. Tip number 6. Switching off. Try not to become too focused on electronic entertainments such as TV, games, mobiles, tablets, and other devices. Consider turning them off even for 5 to 10 minutes a day. Tip number 7. Engaging with others. Make the time to connect with people who make you feel good. Ensure you make time to see your family and friends in person, not just online. Tip number 8. Joining in. Joining a club, group, society, union, gym, or whatever you are interested in. Getting involved in your community and building strong social connections is an important part of maintaining good mental health. Tip number 9. Exercising your mind. Exercise makes you feel better. Even moderate levels of exercise, as little as 10 to 15 minutes a day, can improve your mental health. Tip number 10. Seeking advice and support. If you feel things are getting too much and you aren't coping, talk to someone and seeking advice and support from them.
Conclusion. Though there are few large-scale observational studies available in this field to date, it is clear that the COVID-19 pandemic has led to a vigorous response from psychiatrists and allied professionals, and that mental health is clearly being taken into consideration at multiple levels, such as in general population, among health workers, and in vulnerable populations. As the number of patients affected by this pandemic continues to increase, the psychiatric profession, particularly by Asian countries, faces both a challenge and an opportunity. Researchers should also attempt to assess the impact of COVID-19, and the interventions developed should be so effective in therapeutic strategies for the well-being of mental health. Once more, I remember you, mental health is not a destination but a process. It's about how you drive, not where you are going. So, love your mind and be always physically and mentally healthy.